Everyone, and welcome to Rural Divide, Unequal Access to Children's End-of-Life Care. Today, we're diving into a really important and sensitive topic, the challenges children face in accessing hospice care, especially those living in rural areas or underserved communities. It's about making sure every child, no matter where they live, gets the support they need during difficult times. Our debate question for today is, how can we effectively bridge the significant gaps in pediatric hospice care for rural and underserved children? We'll start with opening remarks from our debaters, move into a discussion, then rebuttals, and finally a conclusion. It's all about understanding different viewpoints. Joining us today, we have Eleanor, who is a strong advocate for equitable healthcare access for children. Eleanor believes we need urgent action to address these disparities. And on the other side, we have Sophie, an expert in healthcare policy who will explore the practicalities and complexities of expanding these vital services. This topic is incredibly relevant for all of us, especially as future leaders and citizens, because it touches on fundamental issues of fairness, healthcare access, and community support. Understanding these challenges helps us think critically about how we can build a more compassionate society. So, without further ado, Eleanor, let's start with your opening remarks.
Thank you, Maggie. When we talk about pediatric hospice, it's crucial to understand that for many children, especially in rural areas, the care simply isn't there. We see a significant lack of clinical competence across all disciplines, from doctors to volunteers, because they just don't have enough exposure to pediatric patients. This isn't just about numbers, it's about quality of life for these children and their families.
I agree with Eleanor that the disparities are stark. However, addressing them involves navigating complex policy landscapes and financial realities. Many hospice organizations are geared towards adult care, and adapting to the unique needs of children, especially with limited resources, presents substantial challenges.
That sets the stage well. Eleanor, you mentioned a lack of clinical competence. Can you elaborate on the specific barriers that prevent these vital services from reaching rural children?
Absolutely. Beyond the limited exposure, we're talking about a lack of specialized training for staff, significant financial concerns for smaller hospices, and frankly, organizational priorities that often favor adult care. It's a systemic issue that leaves many children without the specialized support they desperately need.
And to add to that, Maggie, when adult hospices do try to manage pediatric cases, it often falls outside their usual scope. This can lead to fragmented services, where coordination becomes a huge challenge, and the child's specific needs might not be fully met. It's not for lack of trying, but rather a lack of specialized infrastructure.
So it sounds like a combination of training gaps, financial hurdles, and structural issues within existing hospice models are creating this rural divide. This brings us to a critical piece of legislation, the Concurrent Care for Children Requirement, or CCCR. Sophie, could you explain what that is and how it's meant to help?
Certainly. The CCCR is a federal law that allows children under 21 to receive both hospice care and disease-directed or curative care simultaneously. This is a huge step because it means families don't have to choose between comfort care and trying to cure their child, which is a heartbreaking decision no parent should face.
It's a fantastic concept, Sophie, and it truly protects families. However, the reality is that its implementation varies wildly across states. Many lack clear regulatory guidelines or the necessary support, which means the promise of concurrent care isn't reaching all the children it's intended to help, especially in those underserved areas.
That's a really important point, Eleanor. So even with a federal law designed to ease the burden on families, the inconsistent state-level implementation means the disparities in access persist. What are some of the unique aspects of pediatric hospice care that make it so different from adult care and perhaps harder for these general hospices to provide?
Well, children's illness trajectories and the timing of death are often very different from adults. There's also a huge emphasis on continuity and coordination of care, often involving multiple specialists. Plus, there are fewer evidence-based guidelines for symptom management in children, making it more complex.
And we can't forget the ethical and legal considerations, Maggie. Things like assent from the child and surrogate decision-making are much more prominent. Also, pediatric hospice often focuses on legacy building, memory-making activities, and creative expression, which are unique and require specialized training and resources that adult hospices might not have.
Exactly. It's not just about medical care. It's about supporting the entire family through an incredibly difficult time in ways that are developmentally appropriate for the child. That requires a very specific skill set and approach.
It's clear that pediatric hospice care is incredibly specialized and distinct. So, given these unique challenges and the existing disparities, what are some of the most promising solutions or strategies you've seen to bridge this gap, particularly for rural communities?
From a policy perspective, clearer state guidelines for CCRIR implementation are crucial. Also, fostering Medicaid partnerships can significantly enhance funding and support. We need to incentivize states to provide robust frameworks for concurrent care.
And practically, Maggie, it's about pediatric-specific training and certification for hospice staff. Collaboration with regional children's hospitals and community providers is also key. They can share expertise and resources, making specialized care more accessible even in remote areas.
Absolutely. Utilizing existing resources like the NHPCO Pediatric Facts and Figures or state-based coalitions can also provide invaluable guidance and support for hospices looking to expand their pediatric services.
So, a multi-pronged approach involving policy, training, and collaboration seems essential. It's about creating a system where every child, regardless of their location, can access the compassionate and specialized end-of-life care they deserve. Thank you both for shedding light on these critical disparities. Eleanor, Sophie, this has been an incredibly vital discussion. As we wrap up, I'd like to invite each of you to offer your final thoughts and a key takeaway or question for our audience.
Thank you, Maggie. My core argument remains that the systemic issues, the lack of specialized training, financial strain, and inconsistent implementation of the concurrent care for children requirement are creating a profound injustice for rural children. It's a failure to provide essential, compassionate care. This isn't just a policy debate. It's about the fundamental right of every child to dignity and support at the end of life. I'd like to leave our audience with this. How can we, as individuals and future leaders, actively push for the policy changes and community support needed to ensure no child is ever denied this crucial care simply because of where they live?
And from my perspective, while the disparities Eleanor highlights are undeniable, the path forward lies in pragmatic solutions. We need clearer state-level guidelines for concurrent care, robust Medicaid partnerships, and better utilization of existing resources to help adult hospices adapt to pediatric needs. It's about building sustainable models that can truly reach these underserved communities. My final thought is that addressing this complex issue requires a multifaceted approach, blending policy reform with practical, on-the-ground implementation. So consider this. What specific, actionable steps can local communities and healthcare organizations take to better support pediatric hospice services, even when resources are limited?
Well, Eleanor and Sophie, thank you both for such an insightful and passionate discussion. We've heard compelling arguments today, highlighting both the urgent need for equitable access to pediatric hospice care, as Eleanor so powerfully articulated, and the complex policy and practical challenges involved in achieving that, as Sophie expertly laid out. While there are different approaches, the shared concern for these vulnerable children is clear. I encourage all of you listening to reflect on what we've discussed. Think about the ethical responsibilities we have, the role of policy in healthcare, and how communities can come together